We're all human, and it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida, and welcome, South Florida and beyond, and on globally on the iHeartRadio app. Welcome to Doctors Are People Too. First, I just want to thank Patty Villa for last week for interviewing Dr. Eric Beyer and Dr. Fernando Bayron for me as I was on vacation in New Orleans. So it was a great vacation. I'm glad to be back. Today we have a ankle and foot surgeon, and we're going to get into a little bit more about that. I just want to let you know who I am and who you're dealing with today and taking you on this venture of health. My name is David DiPino, professional writer since 1999, written for over 50 newspapers in South Florida. And now I am hosting my own show where we like to give, the health topics of, recently what's going on, but also kind of talk about what doctors do outside of practicing medicine every day. So the show is Doctors Are People Too. And the number, if you'd like to call in, is 1-888-565-1470. And if you'd like to have your doctor on the show, just email me at ddipino@gmail.com. So before I get going too much, I was just talking with the doctor about talking too much to start with. But we have Dr. Daniel Selbst here. Doctor, how are you?
I'm doing great, thanks. How are you doing?
Great, thank you. And
Cool.
Thank you for coming to Doctors Are People Too. Really
Sure.
appreciate it.
A pleasure being here. Thank you.
So now we met actually at the YPAD, which is Young Professionals Association of Delray, which I try to go to all the time. And it's a great group. I think it's for under 40 professionals, maybe a little over, because I'm close to that range anyways. But we were actually at Saltwater Brewery, and we just ran into each other, a great, networking event. So I'd like to definitely give them a shout out for YPAD and Delray. You can just look it up, Young Professionals Association of Delray. It's with the Greater Delray Beach Chamber of Commerce. But that's where I met you, and first thing I thought was, wow, this is a podiatric surgeon, and you'll have to fix me on that. I know you're a doctor of podiatric medicine. I think it's DPM and foot and ankle surgeon, but you look really young. But then when I got talking to you, I was like, wow, this guy is a wealth of knowledge, and we definitely all need a good podiatrist. So thanks for coming aboard. Tell me a little bit about how you got involved into medicine.
Sure, absolutely. Well, I come from a family of a lot of doctors in my family, so I've been around medicine most of my life. And I have a little bit of shadowing history from my uncles and aunt and my dad. Even my mom used to work in a lab as a lab tech. So there's definitely a lot of medical experience in my family, firsthand or secondhand, I guess.
And where are you originally from?
I grew up down here in
really?
Hollywood and Weston, Florida. So.
Oh, nice area.
Yeah.
I like that.
Exactly.
And then I was looking online. You went to the University of Florida. You're a Gator.
Yep, I'm a Gator. I went to University of Florida, go Gators. And then I did my podiatry training down at Barry University in Miami Shores. And then I did my residency up in Lutheran Medical Center in Brooklyn, New York.
Oh, wow.
So I was up there for 3.5 years. Yep, up in New York.
To do a residency there. Mm-hmm. Very busy residency then, right?
Yeah, it was very busy.
Did I read online too that that's a trauma hospital?
It is. It's one of the 2 level 1 trauma centers in Brooklyn.
Wow.
So yeah, a lot of traumas came through there while I was there.
I mean, can you say what one of the most common, were you already studying ankles and feet? What was something of the most common things?
Well, I definitely saw a lot of foot trauma. Foot and ankle trauma, but I mean the hospital, of course, the hospital takes traumas of all sorts, motor accidents, slip and falls, any work accidents. There were a ton of traumas, unfortunately, that came through, but it was a great experience, and I'm very grateful that I got a get the best training I could at Lutheran Medical Center. It was a great
and
experience.
High volume as well of patients.
Oh yeah, lots and lots.
And now you mentioned kind of all kinds of traumas. When you're doing your residence, do you you kind of see patients with all kinds of traumas? You're not specifically focused on the foot and ankle at that time?
So when you're a resident, there's I guess different levels of training. We start as a first year. In the first year, you do mostly start on podiatric foot and ankle related traumas and injuries and conditions, and then from after you do that training, your second year, you're overseeing the first year, and then part of my program, the third year, was strict ortho trauma and overshadowing the podiatric portion as well. So we got a very good experience.
And thank you for saying that very nicely, podiatric, because I kind of stumbled right out of the gates there, trying to call it all kinds of different things, and also for the explanation of residency. I think as patients and more of the common population, we know that you did medical school residency and whatnot, but maybe we don't totally understand. So that was a very nice explanation. I appreciate it. And so you lived in New York City during that time. That must have been amazing as well.
It was definitely a great experience in New York. I mean, I got to see the shows. I got to see the sights, a few baseball games here and there. And, it was a lot of fun. A great experience.
Did you have a preference, Yankees or Mets, when you were there, or kind of saw both?
Well, I've been more of a Marlins fan from the beginning, but I guess of the two, I have to go with the Yankees. Just, I don't know.
There you go, for all you Met fans out there. No, you still got to go see Dr. Daniel Selps. And we'll get into a little bit more about the Marlins. I'm actually a native Floridian, so I've watched the Marlins since day one when Charlie Huff pitched a 6-3 win in 1993. Cool. And yeah, unfortunately we're on a health show, but he was smoking cigarettes in the dugouts in between. But that's Charlie Huff, the knuckleballer. But we'll get more into the Marlins. And now I want to give out your information, but I just want to be correct. Now, I found you on, is it BocaRatonPodiatry.com?
Yep, that's my main office website.
Okay. And phone number 561-395-4243.
Correct.
And where is that located in Boca Raton?
So my office address is 950 Glades Road, which is across the street from the main FAU campus entrance on Glades Road. So it's Glades and University, or Glades and 10th.
Okay, nice. And I went to FAU, so... And I need a podiatrist, so I'm going to come to you. I mean, we got a lot in common here, so that's great. Now, I also read a great bio on the website about you. You actually started private practice in Jacksonville, correct?
Mm-hmm. Yep, that's correct. I was part of a group in Jacksonville, private practice group. I started there right after my residency and was in Jacksonville for about 3 years. And then I decided to relocate back to South Florida.
And what was that like in Jacksonville? I know it's like the biggest land volume city in the United States, or that's kind of the factoid about it.
No, it's a great city. They have they have lots to do there. It is a large landmass area with a very large population as well. But no, it's very nice living there. I mainly relocated back down south because I have family here and wanted to be a little closer to my family. So.
Yeah, people don't realize that's like a whole nother state up there. It takes a while to get up there.
It is. It's a long drive up to Jacksonville, back and forth.
And my listeners may remember I went out of town for a week. I actually drove to New Orleans from here.
Oh, wow.
So, yeah, I made it overnight. We left at 8, and I made it all the way to about Pensacola about 4:30 in the morning.
Wow.
My wife tapped me and said, hey, you're biting your nails and you never bite your nails, and you're starting to hit the reflectors. Why don't you pull over? And I've been sleeping a couple hours, so... It was good that I did, but man, I almost made it out of state. It took a long time.
Gosh,
it's quite a drive. And Jacksonville is just to get out of Florida. I mean, was like 6-7 hours.
It is a while. Yes, I drove from here to New York and back again.
So yeah, you came back to family and friends. What brought you to Boca Raton? Why'd you choose Boca Raton to further your medical career?
Sure. Well, after deciding to relocate back to South Florida, I did a little surveying and met some doctors and found an excellent opportunity to work with Dr. Frisch and Dr. Kazimias in this office. So it's going very well so far, and I'm enjoying the office very much.
And I saw those doctors' profiles also. It's Boca Raton. Podiatry.com is a great website, a lot of info on there. And we're going to get into a little bit more about computers and websites because I have a couple of questions for you. I know you have a unique background. But before I do that, we have a couple more minutes till we take our first break. And I kind of want to let the listeners know, like, what are your areas of interest? What kind of things you specialize in? I know there's a little on the website, and correct me if I'm wrong, about ankle joint surgery and specializing in that a bit. But what are your areas of interest, the basics you treat, and then kind of take it to another level, and you can get more into clinical medical talk?
Absolutely. Well, in podiatry, in the podiatric field, my main interests are doing surgery and wound care. We treat anywhere from little kids in the office with some more mild problems to adults ranging of various problems, from acute injuries to these chronic problems with diabetes, ulcers, and foot changes and so forth.
So wound care, I've heard a lot in my studies. Since I came into healthcare, I'm a writer by trade, but I've been in PR the last few years. Now, wound care, is that something that could tie into anything from like diabetes, or like even I've heard like if you have a bad cut on your foot that could maybe cause infection that could really enter the body from I guess that area. Is that kind of what we're talking about?
Exactly. Anytime you have a break in the skin, you technically have a wound or an ulcer, and this break in the skin can get infected at any time. So it's important that this be addressed as soon as possible. And if you have risk factors such as diabetes, neuropathy, decreased circulation, there's a high probability that these will progress to even worse prognoses, worse problems, if they go left untreated.
And if you have a question for Dr. Daniel Selbst, he is here till 7:30 p.m. tonight, or anytime at Boca Raton Podiatry.com. Our number here is 1-888-565-1470. Now, also, I wanted to ask you before we go to break, is a foot injury to the foot or ankle, can that also kind of gradually cause problems, maybe further up the leg, knee, back, etc.?
Sure, absolutely. There's several problems that in the foot that can definitely trickle their way up the lower extremity, and sometimes they're structural problems, sometimes they're functional problems. One of the most common things podiatrists do for people is we make them orthotic. So if you have a problem, you should definitely come see a podiatrist and be evaluated for something as simple as putting an insert in a shoe and fixing, like you just mentioned, any of those problems, foot, ankle, knee, or hip problems.
Okay, and now you also participate in some wound research for a wound care product designed to kind of accelerate the healing process. Is that something that you're involved in clinical research as well, trying to bring your patients the best and latest that's out there?
Absolutely. I was practicing up in Jacksonville. I was part of a research study, and this was studying one of the newer products, mostly now being used for wound care. We've recently had some major advancements where we're now using amniotic membrane tissues to harvest stem cells and stem cell components to help regenerate and grow new tissues and accelerate healing of all sorts. From wound care, and some doctors are also using it for other types of injuries, such as tendinitis and other injuries as well. There's several uses for these products.
Nice. And we're here with Dr. Daniel Selbst. He's an ankle and foot surgeon, podiatric medicine, at Boca Raton Podiatry.com. We're going to take a quick commercial and then come back and talk to Dr. Selbst about what hospitals he's on staff at, a little bit about an upcoming appearance around the corner, a health lecture that he's got coming on. So stay with us on Doctors Are People Too.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Chance, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary artery disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. I also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back with Doctors Are People Too. We have Dr. Daniel Stelpst here. He is a doctor of podiatric medicine and foot and ankle surgeon. I think I got that right this time. Dr. Stelpst, you were just telling me during the break that you have two brothers and a sister that are in medicine?
Yeah, that's true. I've my most of my family does something in medicine. So I have two younger brothers, and they're both also podiatrists. Wow. One practices semi-locally out in Tamarack, and then the other brother is out in Houston. And so both podiatrists. And then my sister is out in St. Petersburg in her residency. She's a pediatrician out in St. Petersburg.
Wow, you are the definition of family medicine, family practice, all the above. Now, two brothers that are podiatrists, I mean, you can kind of share, I guess, you don't share patient information, but you consult on the phone, etc. I don't know, but yeah, that's got to be awesome to have that background.
No, we're all very fortunate. We do discuss cases and so forth, and notes, compare notes every now and then, and see if there's anything new. We're definitely sharing new knowledge. As soon as one of us hears something, the other one hears something. One of my brothers was trained at a very prestigious hospital in Texas, in San Antonio, and he's very, very well trained in surgery, and all of us are. So it's really great.
I think that's important because the doctors that I meet through the show, they all seem to have a really good web of colleagues and peers to rely on, to bounce off of, and I think that's really important. Even as a writer, I have different people I'll send stuff to edit, so that's really neat to hear.
Sure.
Now, as we're ripping right through this interview, I want to ask you a little bit about what hospitals you are on staff at, because I know you're in Palm Beach County and over into Broward County. So you want to share with the listeners which hospitals?
Sure. So I'm on staff currently. I'll work my way down. I'm on staff at Bethesda, East and West. I'm also on staff at Delray Medical Center, Boca Raton Regional Hospital, and Broward Health North.
Wow. I don't know if I've met a doctor that's been on staff at more hospitals. Now, and you're also board certified in podiatric medicine?
Currently, I'm board qualified. It's a several tiered process to become certified. I'm on my way to being certified.
Okay, got it. And now also, we were talking a little bit about during the break. You work at a wound center just around the corner in Broward, and I want to give out the number. There is 954-786-2387. Can you tell the listeners a little bit about that?
Sure, absolutely. So I'm on staff at Broward North, and on 1 day a week, I'm staffed in the wound center, and we treat, being a podiatrist, I treat wounds and ulcerations of the lower extremity, from venous ulcerations of the leg to diabetic ulcerations of the foot and ankle. We treat pressure sores, venous insufficiency related ulcerations, and circulation insufficiency or PAD related ulcerations. And we do a very thorough evaluation and aggressive but appropriate treatment for that person to get them better as soon as possible.
And is that those things that you see in the older population? Because you said you treat pediatrics as well, but the ulcerations and the wounds.
Sure. Ulcerations can occur. Again, it's an ulceration is just any break in the skin, and unfortunately, the population is aging, and as it ages, more chronic diseases such as diabetes, peripheral arterial disease are becoming more and more prevalent. And because of that, more people are prone to getting these conditions related with these other diseases. Okay,
and then I also read on your website, that's BocaRatonPodiatry.com. I want to give that out as much as I can. You have an upcoming appearance where members of the community can come. You lecture a lot, I saw on there, that you're always posting when you lecture, but it's a health lecture around the corner here called Positives of Wound Care Therapy, and it's on this Thursday, August 4th at 2:30 p.m. Wow, how timely.
Right, exactly.
Deerfield Beach Percy White Library. That's 837 East Hillsborough Boulevard, Deerfield Beach. Now, can you talk a little bit about your lecture on positives of wound care therapy?
Sure, absolutely. So I'll be definitely discussing some of the problems seen with ulcerations, what causes them to exist, why they don't heal, and what can be done to help get them healed as soon as possible, including conjunctive therapy. Depending on what the issue is, we'll address if it's venous insufficiency, adding compression, and so forth. And one of the other adjuncts to wound healing is hyperbaric medicine, which is where you do what's called a dive. You get into a compressed chamber, and they pump the chamber full of oxygen, and by breathing this increased pressured oxygen, you're actually able to cure and resolve many problems that otherwise don't resolve. And those can be things such as problems with decreased circulation, the venous ulcerations that are chronic, diabetic ulcerations, chronic osteomyelitis or bone infections can be treated by going into the hyperbaric chamber.
Well, is that the same kind of chamber that they used to use for divers with the bends?
Similar.
Okay.
Yeah, they've made some advancements to the chamber and things to make them more comfortable. At the wound center where I'm practicing at Broward Health North, they actually have some of the, I believe it's the largest enclosed monopod chamber, or monoplace chamber. So it allows only one person at a time, but it's the largest one available in the U.S. for one person at a time. And you can even, I've seen people, you can sit up in the chamber while you're undergoing therapy, so it's more comfortable.
Unbelievable. I mean, the way medicine is moving, and we're moving really quick. We only have about 4 more minutes here. So I wanted to talk to you. I want to get to this point. I always throw a curveball at the end to our doctors, kind of see what they do outside of medicine. I see that you have a unique love of computer engineering. Actually, did you get your undergrad in computer engineering?
Yes, I actually studied computer engineering. During growing up, I was always, when computers came out, when I was in middle and high school, I was always interested in how they work. So when I was in college, I decided I wanted to find out how they work, and I went in and studied them. I was always pre-med and knew I wanted to go into medicine, so I took the courses consecutive or at the same time, and definitely found out how they both work along the way.
Now, and you won Outstanding Webmaster by the Florida Podiatric Medical Student Association.
Yes. So while I was in podiatry school, I helped them set up a web page, and we used it for exchanging of notes and information to help us learn more during our podiatric studies at Barry University.
Now, did you design the website at BocaRatonPodiatry.com?
I didn't design it. Yeah, well, the group had already existed, so I definitely modified it and embellished it a little bit when I joined in.
Yeah, I was going to say it's very easy to use, and
thank you.
You know, I had a ball on it. Actually, I got a ton of info on you and the other doctors there, so check it out, BocaRatonPodiatry.com for the listeners. And we only have a couple more minutes. The number's 1-888-565-1470. But you can find out more about Dr. Selps at BocaRatonPodiatry.com or 561-395-4243. Now, I also wanted to talk to you a little bit about, you're also a musician as well. I kind of am a musician on the side. I have 5 guitars, a banjo, ukulele, accordion, etc. But what do you play, and what is your favorite band? What is your favorite kind of music?
Sure. Well, I have so many favorite groups because I like so many types of music. But it's hard to say just one favorite band, gosh. But I do like a wide variety of music, from classical to rock to even a little country and jazz and just about every genre that's out there.
And what kind of instrument do you play?
I play a few. I started when I was just 3 years old. I started on violin. And then when I was in middle and high school, I picked up the trumpet and started playing that, and added jazz band, marching band, even played in the marching band at University of Florida. So that was a lot of fun. I also play a little piano and picked up just a little guitar. I know you play guitar on your thing.
Neat. That's really neat. So you played at the home games was it Ben Griffin Stadium?
Yeah. Ben Griffin Stadium. Yeah, not just the home games. That's I got to travel with the band too.
Okay.
Yeah, so that was a big perk. We always had a good seat and a guaranteed good seat.
Great places
and you got to travel. Yeah,
it
was a
Clemson,
lot of fun.
Auburn, Alabama, Ole Miss, everywhere.
Yep. And the bowl games. Don't forget the bowl games.
Oh yeah, the bowl games. And we're going to talk a little bit that to wrap it up here. You're a Florida Gator fan avidly and follow their sports. And I went to FAU, and I just got to let you know that FAU last year ran with the Gators all the way to overtime. It was tied. I mean, what happened there, and what do you think of this year's team?
I guess we have to wait and see how we're going to do, but I have good strong feeling in the Gators, Gator Nation and everything. Yep.
That's awesome. And basketball as well. I know they have a great baseball team. You follow everything. Softball.
Yeah, absolutely.
If it's Gator, you're following.
If it's Gator, I'm there.
Yeah. I just will give a little shout out around the corner. Charlie Partridge and FAU. They were 3-9 last year, but that's a young team. And if they get to 6 wins, they're going to a bowl game this year for sure, because they have a very talented team. So hoping to go to some games. And I know they're playing Miami early on. So we hung with UF in Miami last year. So that's my claim to the local sports landscape. Well, I know we're getting really close here to the end of Doctors Are People Too, and I definitely want to have you on in the future. Again, It's BocaRatonPodiatry.com is where you'll find Dr. Daniel Selps, and thanks you again for coming on the show.
Sure, appreciate the opportunity. This is great. Thank you.
Join us every Monday night on Doctors Are People Too here, 7 to 8 p.m. on 1470 AM and amp2.tv.
My dad is a cardiologist, and so I have 2 brothers, and we were all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in, and the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
Welcome back to Doctors Are People Too. It's Monday, so, come Monday, it'll be all right, as Jimmy Buffett once said. And I think we have on the phone here from North Shore Medical Center, radiation oncologist, Dr. Vincent Batone. Dr. Batone, how are you today?
Hi, how are you? Thanks for inviting me on the show again.
Yeah, thank you. We had such a long talk going last time. I wanted to have you on again because I don't even think I got to half the things I wanted to talk about. So I really appreciate you taking the time from your busy schedule there at North Shore Medical Center.
Welcome. Thank you very much for inviting me again. Thank you.
Now, actually, Doctor, it's pouring over here in Boca. How's the weather over there in Miami today?
Well, I'm looking out over South Florida, over South Beach, and it is slightly cloudy, but there is no rain.
Awesome. Yeah. We got our weather report out of the way, so that's great. Now, I want to get right into this Edge device. I know that you're the, and you can correct me if I'm wrong, but you're the only hospital in Miami-Dade County that uses the Edge for is it radiation oncology? Can you explain the Edge and kind of what type of cancers it treats and anything I missed there?
Okay, sure, yeah. So last time I think we were talking about this new technology that just came out last year. It's a technology based out of the United States, actually, made by Varian, which is a U.S.-based company. And it's kind of the culmination of advances in decades of linear accelerator technology. Basically, radiation therapy technology has, progressed over the years, become more accurate, more sophisticated, and this is basically the latest technology that they have. And in terms of what tumors, what cancers they can treat, basically all solid cancers, including breast cancer, prostate, lung, and even the less common ones such as brain tumors, pancreatic cancers, rectal, cervical, head and neck, skin cancers, lymphomas, sarcomas, you name it, it can do it. Right? It's a workhorse. It can do everything. But the main specialty of it is its precision. So it's really very good for very, very precise targets, tiny lesions next to or lesions next to very important structures like an optic nerve, or the spinal cord, things which you don't want to radiate, and where the tumor is right next to it, you still want to radiate the tumor, but you want to be very precise with how you go about doing it.
Now, Dr. Batone, you made a great point there, how you treat different parts of the body. I think if you could maybe explain to the listeners now, a radiation oncologist treats all parts of the body. I think that is kind of obvious, but in a way, I was kind of thinking, maybe, because we know how so many doctors specialize in certain parts of the body, but you treat the all over the body as a radiation oncologist?
Well, yeah. I mean, the first thing is that a lot of patients have been asking the question. They don't need to be educated about the difference between what radiation therapy is versus chemotherapy versus So these are quite different things entirely. Chemotherapy being a medicine that's injected into the body like intravenously. Radiation is nothing like that. It's entirely done from a distance patient would be lying down on a table. It looks like you're in a standard, getting like you're going for a CAT scan in a sense. But instead of using lower energy, it's using a higher dose of energy, and that can be used on any part of the body, right? Because anywhere that couch lies, the machine can treat. Right? So we can treat tumors in any part of the body. But in general, the radiosurgery is used primarily for certain sites, particularly like lung cancers. It can be used for cure, for brain metastases. It can be used instead of surgery. It can be used for bone metastases, liver metastases from other tumors instead of doing surgery or microwave ablation. It can also be used for unresectable pancreatic tumors or even renal cell tumors instead of doing surgery. So we can actually use this device to treat patients without even using surgery. And so patients that are typically have never had an opportunity because they were just either too sick or had too many other medical comorbidities or other conditions, we now offer them still options for potential cure for cancers that are curable, but they just could not go through a surgery.
I see. So I want to bring it back to the edge, and I thank you for doing that because I kind of threw a question on the side there to you as you were explaining the edge. But let's go back to the edge as you brought us back there. And I know you mentioned a little bit about, is it the linear accelerator? And if I'm correct, tell me how that works kind of to help the edge, do its job in eliminating cancer.
Well, ideally, we know we can kill basically any cancer cell if you throw enough of a higher dose of radiation therapy at it. The cell will die, or it'll try to divide, and it will just simply die. So, ideally, in a perfect world, if you can radiate just tumor cells, the tumor cells would die, and if you could avoid the normal cells would be fine. And so the technology of the edge is called that because you can literally carve an edge of dose where you literally can have a high dose of radiation right next to an area of low dose radiation. So there's like a defined edge, like you can even see the edge. It's like an edge. That's why they give it that name. So that's where the technology has come from. So anytime you're using high energy radiation therapy, we are going through normal structures, but you want to minimize all that dose to the normal structures and really kind of overlap all the high dose radiation on the target of choice, which would be the tumor.
Wow, Dr. Baton, thank you so much for putting that in layman's term, kind of for the listeners driving around and myself as well. You have a unique gift of explaining the most clinical stuff in layman's terms, and that's really helpful. I thank you for that. Now, Dr. Patone, I want to, so we're here with Dr. Vincent Patone on Doctors Are People Too, and we're talking about the EDGE, which is a radiation oncology tool used to treat cancer. And you were telling me before, Dr. Patone, that North Shore Medical Center in Miami is the only hospital in Miami-Dade County that uses the EDGE?
Yes, we're the only hospital that has it. I believe there is one other clinic that's a freestanding facility that's not attached to a hospital that has it. And there is one now in the Broward County Center, but in Dade County, we're the only hospital that has the EDGE machine. That's true.
And I think we talked about last time I had you on a month or two ago on Doctors Are People Too. You were telling me that you obviously get a lot of patients from Miami-Dade County, but you do have patients that travel, a pretty good distance to see you because, you guys cover all over South Florida.
That's true. So people often ask how long it takes to treat or how long it takes to wait for an appointment. So in general, for an appointment, it's usually one, maybe 2 weeks max. Although urgent cases could be seen on the same day if they're entering through the emergency room. The treatments themselves, if it's a radiosurgery, that's only a single treatment. Whereas let's say a lung treatment, that would be a maximum of 5 treatments. Okay, so the treatments don't take that long. So 5 treatments, that's like Monday, Wednesday, Friday, Monday, Wednesday type schedule. So a week and a half, and they would be done their whole course. A single treatment would, of course, be done in a single day. But keep in mind that most of the time of our treatment it goes into the setup and the immobilization of the patient. We have to do a CAT scan to capture the patient's specific anatomy and the exact location of their tumor. We often combine those images of our CAT scan with their PET CT scans or MRI scans that they've done at other centers so that we can get a very accurate view of the tumor and where we're going to treat. We actually fuse the images together, and that takes some time. And we actually have a whole treatment team. We have myself, a physicist, and dosimetrist. We then take the time to make the perfect plan to concentrate and maximize the dose of radiation to the tumor while minimizing the dose to the nearby healthy organs and structures that we don't want to harm. So the first day really is just about getting things, organized in terms of setting things up. And then once everything's done, usually a few days later, they come in to get the actual treatment.
Now, Dr. Batone, you were talking a little bit about by appointment or urgency, maybe seen day of if it's a very urgent case. Now, do you have the number there for patients if they need to make an appointment in the future?
Sure. Yeah, the phone number here is 305-835-6173. That's 305-835-6173. And the center is North Shore Cancer Center, located at 1100 Northwest 95th Street in Miami-Dade County. 1100 Northwest 95th Street. It's right off of the I-95. It's pretty easy to get to. Again, it's best to call always because we're quite busy. And again, if it's an urgent case, obviously please go to the emergency room. If anything urgent is happening, you should always go to the emergency room.
Thank you for pointing that out, Dr. Batone. We have a couple more minutes before our break here, and then we'll have Dr. Batone back on the other side. But so it's Dr. Vincent Batone. You got here 21st century oncology, so that's great to hear that that is as recent as common, and the most recent updates he's using here to treat cancer, which we've all been touched by. And the number is 305-835-6173. And I got the website here, northshoremedical.com/edge is where you can kind of find a little bit more info about this Edge device. Doctor, I think I have time to fire off one more question before the break. And now this Edge treatment, you mentioned it could be 1 to 5 treatments, etc., no matter on the case. Is this something outpatient that people can walk out of the hospital with, or do they have to stay in the hospital?
Oh, no, this is done mostly, almost entirely as an outpatient treatment. Patients come in, they walk out without even feeling like anything's happened to them. Like you went for a CAT scan or like you went for an MRI. You don't really feel anything from these treatments for these kinds of, specifically the radiosurgery treatments. We do also treat inpatients, though, that are within the hospital. Like I said, the Edge machine can be used for traditional radiation therapy, not just radiosurgeries. So we can do the traditional, radiation that takes, up to 9 weeks to treat a prostate cancer or 5 weeks for breast cancer. That it can be used also for, conventional radiation therapy purposes, in a highly accurate fashion. So we use it in both ways at our facility.
Dr. Batone, stay on the line. We're going to take a quick break. Doctors Are People Too. We have Dr. Vincent Batone on, radiation oncologist there at North Shore Medical Center using the Edge, and we'll be right back.
I make a dinner for me and my girlfriend. We ate, we enjoyed. The dinner was very good. She was ready to go to sleep. I said, okay, I'm going to stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking. And all of a sudden, I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I described like an angel. I described like he was there to do that for me. my girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red one, that light red one. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life, and I had to take advantage of this.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back on Doctors Are People Too, South Florida and beyond, and globally on the iHeart Radio app. We have Dr. Vincent Patone here. He, 21st Century Oncology, NorthShoreMedical.com/edge. We were talking about this edge machine that he uses. You don't want to use the term cutting edge all the time, but this thing is cutting edge for cancer. It actually cuts an edge for and distinguishes between, well, the doctor does, between giving a high dose to a certain area that really needs it and lower doses to areas that don't for different kinds of cancers. And Dr. Patone told us the number is 305-835-6173 if you or your family members or even your doctor needs to call and find out a little bit more. Dr. Patone, you still on the line?
Yes, I am.
Thank you. And Dr. Patone's calling from Miami North Shore Medical Center, where he's very busy running the radiation oncology program there. Now, we were talking about the edge machine again, and I think time is such an important factor. And you probably touched on this before, but how long, what's the time range during a treatment for, using the edge machine?
So after initial consultation with me to go over everything with the patient, all their concerns and overall the potential, reasons for using the machine or, what are the risks and all that. Then once we're set up, we'll set up a date for the patient to come in for what we call a CT simulation. So this is basically where we create the setup. If let's say it's a lung tumor, we're going to immobilize their whole body in a special vacuum lock, and so they can't basically move. We use lasers to localize and position the body. We then take special scans in the treatment position, and then once all that information is inputted into our computer, the patient can go ahead and go home while they wait for us to do the treatment plan and process, which, as I mentioned before, is quite complex. You have to have myself, a physicist, a dosimetrist. Once we've created a plan that we find, is excellent, satisfactory to meet all the requirements, we then have the patient return on a specific date. So let's say they come back. It's a Monday at 9 a.m. The treatment itself will only last between 15 minutes, usually about 15 to 20 minutes of time. Because once they're reimmobilized in the same position, the machine will then do its few passes that it needs to do to treat the tumor. So it doesn't take very long. In fact, the tumor is actually has a very high dose rate, one of the fastest dose rates of delivering radiotherapy that's available. So which is good for patients because they don't have to be staying so long in the same position, and it's also better in case of any organ motion that can take place during a treatment. So it doesn't take very long, I'll tell you.
Now, also stayed on the time aspect. I think, obviously people don't like to wait a long time for appointments or whatnot. But if you have cancer, you should really, take it when you can get it. Now, how long typically do people have to wait for an appointment? I think that's the question that I'm getting to here.
Okay, so again, everything can be triaged to a certain extent. Certain cancers that have a bit of a different history to them. Some of them are much longer or slower processes. Some of them are much more rapid, and you want to get around to be treating them as soon as possible. Like a lung cancer, for example, you don't want to wait around on that. So you want, within a week, you want to kind of be seeing somebody and moving forward. Because if you look at it, you got to be seeing a lot of people. You're going to have to be seeing a radiation oncologist, thoracic surgeon, a medical oncologist, and you don't want to be putting in weeks and weeks of delays between all these opinions or second opinions. You want to get moving while the cancer is left to grow and unchecked. So the faster you can get to treatment, the better your chances are. So if a patient calls in and they need to be seen sooner, we can make those necessary arrangements.
Thank you, Dr. Baton. I kind of flubbed that one, and you really explained it there. It really matters, of the progression, and you're obviously the expert, so you and your team will decide, how quick to get people in and out of. I didn't want listeners to get the wrong impression of what I said there. Now, what do patients have to do to prepare for, an edge procedure?
Well, first off, just to comment, I think education. As much as they can, they should read up online, read up about their disease, their condition, bring copies of everything that they've done. Physical copies of all CDs, of all bone scans, CAT scans, MRIs, PET scans, anything that you can get physically. Not just the reports. The reports are not enough for us. We need to actually see the images. So those are ways to speed things up, and that way we can give you a good answer. And this is the first day that we see you, instead of having to wait for those scans to come in. So if patients want to do the due diligence, or the family member wants to go out to each place where they went to go and get their scans, and they just need to ask for them. The scans belong to the patient, so all you have to do is go up there and say, "Hey, I'd like a copy of my disc. I'd like a copy of my CT," and they'll burn them a disc for them. And if you can bring all that on your first appointment, that really speeds things along for us, big time.
And if you want more education on the edge, northshoremedical.com/edge is the website. There's a ton of information there, as well as North Shore Medical Center's website. That'll have a link there as well at northshoremedical.com/edge. Dr. Paton's number is 305-835-6173. Dr. Paton, I see here 21st Century Oncology. I've mentioned it a few times. Why that term, and what is 21st Century Oncology?
Well, 21st Century Oncology is the parent company that provides the services for this cancer center. They are one of the leading oncology groups in the United States at the present time. I believe they have over 188 centers across Florida, Nevada, even in other countries, believe it or not. So they are a very large oncology group that brings a lot of new technologies to the market. And they include not just only radiation oncologists, they include other oncologists on their team. Surgical oncologists are part of the network, medical oncologists, pathologists. And so basically you're getting access to a large network of physicians.
And it sounds like you're on a great team. I think you mentioned physicists before, and I'll probably get this one wrong. Asymmetrist that you work with.
Dosimetrist.
Oh, thank you.
It starts with the letter D.
Thank you. So it's important. You guys obviously there at North Shore have an outstanding team. If you're the only one in that county to have the edge, can you talk maybe another minute or so on the team?
Yeah, the team is very important. I think coming from when a patient walks in, they want to be in a nice environment. You want to be in a place that's clean, new, high tech, warm, welcoming secretary. We have a staff on hand that we have excellent nurses. You want caring, comprehensive nurses that really keep track of the patients and make sure that they do a lot of the things that I can't keep track of on all my patients, because it would just be too overwhelming. So we have good nurses. We have an administrator. Physicists go over all the technology aspects of all the treatments. So they verify and make sure that what I prescribe is what is going to be delivered. So the dosimetrist is kind of like a pharmacist in the sense that they're going to help decide and help deliver the dose of radiation, just kind of like a dose of medicine. But instead of medicine, this is now actually a dose of radiotherapy. And so that's what the dosimetrist does. And then, of course, we have the radiation therapists. These are the people that actually help the patient get treated daily on the actual machine itself. They help put the patient on the table, and help with all the markings and all the technical aspects of the actual treatment itself. And there are other staff members too. We have patient navigators who help keep track of patients. If they come for a visit and they need to come back, and some patients they forget where to go or who to go see. We have a tumor board registry, so we're part of the National Cancer Registry Program in the United States. So every one of our patients is part of the national database. There's a lot of people on the team basically. That it's not a simple thing. It's like one doctor and one patient. It's a huge team. I think we have about 12 to 15 people that are running at the cancer center right now.
Wow, that's an awesome team, Dr. Batone. And one last time we're on the phone with Dr. Vincent Batone. He is correct. You're a radiation oncologist. Am I getting that correct?
That's correct.
Awesome. Thank you. I want to make sure. Now, Dr. Vincent Batone is on staff at North Shore Medical Center in Miami. He told us it's right there off I-95 on the 95th Street exit there in Miami. The website is northshoremedical.com/edge. The number's 305-835-6173. Dr. Batone, I have about one more minute. Listeners always ask, where did you go to medical school and, training and whatnot? I think that's important.
Yeah, I grew up in a big family. I remember I was one of 8 kids, 5 sisters, 2 brothers. We grew up in Edmonton, Alberta, Canada. And I moved to Montreal to study medicine at McGill University, which is one of the best schools in Canada. It's kind of like the Harvard of Canada. And I stayed there for my whole medical school training and my residency training. And I was, top of the class, and I got accepted into a fellowship program with the president of the American Society of Radiation Oncology in New York. And so I spent a year in New York doing fellowship training and specializing in radiation surgery and brachytherapy, which are, subspecialized areas of radiation oncology. And then after that, I decided winter was too much, and I moved to Miami.
Awesome, Dr. Batone. Thank you so much for coming on again. I'm going to have you on in the future. We always run out of time because you have so much great info. Thank you.
All right. Thank you for having me on. Take care.
Bye now.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.